Dr. Blackwell. Thank you so much for taking your time. It's so important for us to have you here. And then it's be the first time that you're going to be speaking for like a Brazilian audience. I think there's Bruna that is also in Brazil.
Hi, Bruna.
Hi.
It's nice to meet you.
Hi, Professor. I am Bruna. It's an honor to be here. Thank you.
Thank you. And are you in Brazil right now?
Yes, in Brasilia.
Brasilia. And what about you, Dr. Tancioni?
I'm in San Diego. I'm living in San Diego.
Yeah.
I just back. Dr. Blackwell, could you tell us more about you, your mission, and the influence of your dad on your journey?
Well, I sure appreciate the question about my journey and the influence my dad had on my life. He was a practicing veterinarian, and so up through my senior year in high school, I was helping him in his practice daily. I had a chance to observe what it means to be of service to society, including a society that may not necessarily respect you as much as you deserve, meaning, as a minority in America, and especially during those days, there was still segregation early on in his practice. And I often think about the fact that he worked every day, 7 days a week, to help those families, mainly with their livestock, which is connected with their economic well-being. But we couldn't use public facilities, in our hometown for many years there. So, but rather than being an angry person, he just was methodically going about doing the work to contribute, knowing that that comes back to you in many different ways. So I was put on a path, even though I'm a minority in America, my path was not as onerous as some minorities because I had this role model early in life. I was shaped by the idea that my minority status would not interfere with my ability to be successful. And I'm so thankful for that, because I've seen many over the years who seemed handicapped because the image that they hold of themselves was shaped early on as supposedly someone who's going to struggle, in part because they're a minority. So yeah, I learned business. I learned a lot of things. I learned how to work with people, and those lessons are priceless. I mean, I don't know how long you have to go to school to learn all I learned. I think a whole lifetime.
Of course, thank you so much for be here. And then one more time, I'm going to the second question. And then what stories could you tell us that inspire you to work on promoting affordable veterinary services for underserved families?
Yeah, so I've had a blessed career, and many positions that were important, high-ranking, impactful. But the work today to improve access to veterinary care is the work that I'm most enjoying. It's like a culmination of my whole career and the things I learned along the way that I'm trying to apply now. Why is this important? Well, it starts because there's pain and suffering and premature death, and I'm talking about situations that are addressable. So, when we're talking about an illness or injury that's treatable, and yet the person can't get health care, that's what we would call unnecessary pain and suffering in our society. And, this inequality throughout society, income, education, other benefits or privileges, we're going to always have that spectrum. And what I personally believe is, as a veterinarian, I'm responsible to the extent that I can help address that whole spectrum of need, meaning the very low income people who need health care, that's just as important for them as people who are upper middle class or even wealthy. And ironically, you know, when we go down the income level to very low income, and those people look around 360 degrees, there's not a whole lot in their lives that gives them happiness, except those pets, you know. To put it another way, if you're middle class, upper middle class, you can look around and you got all sorts of things that give you joy. So I start with the unnecessary pain and suffering, premature death, and then the fact that the people most impacted would benefit the most through these relationships. I often point to seniors as just a good working example, someone who's contributed their entire life to society. Let's say like a school teacher, right? Or some other public servant. Worked their entire life, low wages, to help others. And yet, I refuse to accept that at this stage of life, they don't deserve the privilege of having veterinary care. Especially when we think of a senior who lives alone, their health outcomes look very poor compared to seniors who live with others, who have a social interaction. So I could go on and on and on about the harm being done when we don't ensure all have access to health care for humans and for non-human family members.
That's great, Dr. Blackwell. I think we need to think about this, and then how it's not only the underserved people and also the seniors, and then it's really impactful. I can see how this impacts for example, my parents, right?
Yeah.
People that are close to you.
Yes.
And yeah, that is very good point. I'm going to go to the third question right now. We Brazilians have an idea that most families in the US can afford veterinary care for non-human animals companions. Could you talk about some key results from compilation of studies around access to veterinary care, barriers, current practice, and public policy?
Sure.
That is
Let me
amazing, this compilation of results, by the way.
Yes, I'll touch on some of those results, but let me just set out right in the beginning this to be clear. We have our poor in the United States, a wealthy nation that unfortunately has such a maldistribution of resources, of income, and so forth, that we definitely have our what used to be called working poor. So I'm not even talking about the indigent, like the homeless or unsheltered families, although those populations are growing as well, that population. We used to call them the working poor. Today, they're called ALICE. That's an acronym for Asset Limited, Income Constrained, Employed, traditionally called the working poor. So ironically, again, we've got increasingly more and more families in the United States whose wages are so low that they can work full-time for a corporation, and yet the public has to feed them on a food stamp program or something. You know, this is just insane. We often use one measure being the minimum wage that a person should be paid. And that level has not been changed at the federal level for decades now, and yet everything costs more. So this country has been trending in a very, very bad way. A contraction of the middle class and an expansion of the ALICE class, the working class, the working poor. So we did a national study and reported on this study in 2018, in December 2018. And what we found at that time, and this is pre-COVID-19, we found that 28% of the families surveyed reported that they couldn't get in to see a veterinarian in the past 2 years. So over the past 2 years, was there ever a time you needed veterinary care and you couldn't get it? 28%, more than 1 out of 4 said yes. Now, overwhelmingly, the main reason was limited funds. That was not a surprise. We expected to find that money was at the heart of it. But there are other barriers. We've got a number of social issues in this country that are historic. Minorities are still struggling on many fronts. So even when you have some money to get care, there can be other forms of barriers. For example, we found that some people did not go in because they had a language barrier, or they thought they might be looked down upon. I mean, so even the context of providing the health care for those who can pay should not be ignored. We need to make sure that we're being socially conscious, culturally competent as we deliver these services that are so critical. Since COVID-19, the number of families that struggle in the country has increased, and we just don't know how that's going to end. But when you look over the horizon, there's just no solutions in sight. So what that all translates into, it's immensely important for the veterinary profession to seriously look at what else we need to do to ensure everybody has access to healthcare. Now, one might say, well, wait a minute. If they can't afford me as a veterinarian, then they shouldn't have a pet. So I've heard that a few times, and one might say, well, that's logical. Yeah, that's logical. But the truth of the matter is, at the time of our study, we estimated 29 million dogs and cats lived with families that needed public assistance, the food stamp program, as it's traditionally called. Now, that's a lot of dogs and cats. So if you say that, well, if they can't afford a veterinarian, they should have them, we've got 3 options with those families. We can just ignore them, but veterinarians know that that's not a good option, because we are the front line of preventing and controlling zoonotic diseases like COVID-19. Now, that one is not one we could have stopped the way it entered the population, but there are many. And in this country, many of those diseases are increasing in frequency. So when you think about ignoring these families who need care and can't get it, it threatens everybody, because some of these diseases are quite communicable. The second option, if you don't just ignore them and say, well, we're going to pass laws and we're not going to let you have these relationships because your income falls below a certain level. And of course, that's a bad idea when we start legislating relationships, right? That does not end well. So that leaves the third option, which is simply finding ways to help. And the problem is bigger than veterinary medicine. So we need a One Health approach. Now, just as a reminder for your audience, we know that One Health means that if I really want to do a better job of reaching these underserved pets, I've got to pay attention to and factor in the pet's people. And I also need to factor in their ecosystem or their shared environment, which in this case would be defined by low socioeconomics. And when we say low socioeconomics, it's not just limited money. It translates into a lot of other insecurities just because of your financial status and maybe education and so forth. So to wrap that up, I see us not having an option but to work with other professions who will help us address the human reality while we adjust what we do clinically to make sure something is done to help. Meaning, all right, I may not be able to do the gold standard care, but I can do some level of care to help safeguard what quality of life we can safeguard in that case.
Thank you so much, Dr. Blackwell, again. And then you have some other questions that related to this. And then you talk about a zoonotic disease and about the emotional impact on those families that cannot afford. I think you are the first person that described this to me. This is so important.
I sure appreciate that. You know, I kind of chilled up here when you said that, because it's refreshing to hear a veterinarian point out that this is more than about physical health, that there is a mental, emotional health component here. That depression and anxiety as examples, which are real common in the world, but those are likely to happen, those conditions, when someone is in need of care and they can't get it. And the distress that the family experiences. And if it's a child, the adverse childhood experience. And can you imagine a child who might be the closest one to that non-human in the family, right? Closest to the pet. The pet is ill or injured, needs help. The child certainly understands that, and yet no help comes, no help happens. What are the lessons about life and about one's place in the world where bad things can happen and there's no hope associated with it? We don't want children to have those experiences. So the family is definitely impacted because it's a loving relationship. And if there's a love relationship, whether it's human to human, human to non-human, the impacts are the same. When someone you love is hurting and need help, that negatively impacts one's own emotional and even mental health well-being. But also, Doc, I want to point out the veterinary care team. So I often say it this way, when I think of most veterinarians I've met over the years, including you, you know, we signed up to help. We didn't sign up to turn people away and not help them. And especially if they are in need of real help that we're capable of giving. You know, we know how, we have the skills, but just because of money or something, we are unable to do what we dedicated our lives to. Well, we don't fare well with repeated incidences of that. It's not healthy for our mental health when we are repeatedly making those kinds of decisions. So everybody is at risk. The community is at risk because of zoonosis. The community is at risk because when families are mentally, emotionally not healthy, that feeds out into the community. The family is impacted physically and mentally, and so is the veterinary care team. And of course, the victim being the patient that needs the care. Everybody is losing. This is why we've got to do more than what we're doing today.
Dr. Blackwell is really so inspiring to have this opportunity that you rephrase what I learned from you. That's amazing. Thank you so much for that.
May I just point out one last thing on that? And this is immensely important as the profession seeks to work with other professions and with our government. And I'm so impressed with what's going on in Sao Paulo, Brazil, with the public hospitals, veterinary hospitals. I talk about that all the time, by the way, because we need the same thing here. And it's thanks to you, I became aware of how your citizens decided to take on this issue of access to veterinary care. The thing I wanted to just reemphasize here is too often, when talking about this subject, people are focused on the compassion, which is clearly a very important reason to care. But as we were talking about zoonotic diseases a moment ago, it's more than just compassion that should compel us to not ignore this situation of access to care, but to do something about it. Because again, everybody is at risk if we don't prevent and control zoonoses or deal with the mental health impacts way beyond just compassion.
Yeah, and then you cannot, if you cannot treat a dog, a cat, or other companion animal with zoonosis, it's going to be a huge burden too. And then it's going to be, you just answered my next questions, that what are the impacts on veterinarians who cannot provide veterinary service to people who cannot afford them. That you just answer this. Thank you so much. And then my next questions is something that you just answered, but I would like to know about one aspect. We have heard the following statement from several colleagues. I heard from all over the place and in several countries. People who cannot afford veterinary services for their animal, they cannot have one. How does this statement impact the role of veterinary in society?
Yes. Yeah, and it's really an important one. Let me first say, I really, really encourage my colleagues, don't say that. Don't think like that. And let me explain why. There's a list of benefits that humans get from these relationships. They're mental, emotional, and physical benefits. That body of science continues to grow. Why humans can benefit so much from being in a relationship with a non-human, with a pet. Going back many years ago, this mystical thing of petting a dog, for example, and seeing the blood pressure drop by a couple of points. Well, why is that? Well, nobody knows, but it's a reproducible finding. It's real, it happens. So when I think of the benefits to health, both mental and physical health, and what about the physical part? Well, people with dogs tend to be more physically active, maybe more so than cats. Even if they're a senior, they have to take their dog out and they get social interaction with the community while they're out walking. My point is, when we look at those benefits, and then we look at the folks who are underserved, I'm like, well, if there's anybody who needs these benefits, health benefits, it's the folks who are already struggling socioeconomically. They're not in a position to become ill. They don't have the money to go pay for health care. So when I pick apart the argument, people have a right to choose relationships. I start there. It's a healthy relationship that I'm speaking of here. When I look at the benefits, and especially for vulnerable individuals like that retired senior, like those other individuals who don't have a strong human-to-human relationship. When I look at all of that, come on, colleagues, we don't want to be saying that you shouldn't have a pet. No, the problem is not that. The problem is we don't have a system built to ensure everybody has access to healthcare, human and non-human. That's the problem. And we can build that if we choose to. And that's what our work is about.
That's amazing. I'm enjoying so much of this conversation. And then I'm just going to another question, Dr. Blackwell. Something that I saw you discuss during one of your talks. And then I talk this a lot with my colleagues as well. We heard that some veterinarians chose to be veterinarians because they love animals and it's like people. How can this attitude influence the way we veterinarians treat animals and people?
It's a great question. And, let me start from a position of respect, meaning whatever occurred in a person's life such that they reach adulthood and they don't like humans, there's probably a reason for that. And who am I to say, well, that's bad, you shouldn't think like that? No, maybe if I walked in their shoes, I'd have the same attitude. So rather than trying to fix somebody and say, oh, no, we're going to work on you, you're going to go into therapy so you can learn how to love humans more than animals. No. They're who they are. But that's not the end of the story. Because when they say, well, I'm in the profession because I like the animals and I want to help the animals, well, guess what? the animals don't cause the barriers to healthcare. It's their people and their people's reality. And so if you really are dedicated to helping the pets in this case, you got to be concerned with the pets people. Because first of all, they're the ones who pay the bills. They're the ones who get them to you. They're the ones who administer at-home care. So we're not saying here you got to like them, but I am clearly saying you need to understand your effectiveness as a clinician is tied to that person, like it or not. And so find ways to communicate effectively with those folks in order for them to be an extension of what you do in your clinic. They're part of the treatment team. And maybe through time, some of those colleagues will work out and come to understand, well, why is it that I have trouble with my own kind, my own species? And oh boy, do we put up a lot of reasons. We're quite a remarkable species on this planet. So, and all of us, you know, encountered traumatic events or times when our feelings were hurt and so forth. So I try to be respectful of that and just encourage anyone who's struggling that way to consider talking with a counselor to get to a better place just for your own well-being. But you cannot ignore the people. You can do that the day that the dog gets a driver's license and starts to drive himself to your clinic. And after you've done your services, whip out his wallet and pay you for your services. When that day comes, forget about the dog's people. Until that day, you better figure out a way to work with them effectively, because that's the way you help your patient.
Yes. Yes, it's very tricky, especially in our profession. I heard so many times, and I understand. I can understand and relate to them. And however, this can impact their also services and then the results with the pet. Yeah. And my next question: how can veterinarians promote equity within One Health framework?
Yeah. So I will start by saying we certainly need to be promoting health equity. Health equity is truly a social justice issue, which basically translates in my use of the phrase social justice means it's not policing, although that's a big problem in the United States, for minorities at least. No, the use of the phrase social justice in this context means that a family has or has not the privilege of acquiring health care, the opportunity to get health care. Equity meaning you have the same potential of getting some health care as anybody else. And it's that word potential. You have the potential to get health care. So that means a system is designed for your reality. So One Health is the only way we're going to get to a better place. And we just talked about the fact that the barriers to veterinary care are actually human-related barriers, not pet-related barriers. And so a system that's intended to improve access to veterinary care by design must be primarily focused on the needs of the people in the family, the pet's people. But we veterinarians are not trained to do that. But that's not our job. I mean, we interact with them as clinicians, but what we can do is ensure that we help our communities build systems where these relationships exist so that we are partnering with human health professionals. Now, in our work, at the top of that list is social workers because of the nature of their mission. And we find they're an effective profession in helping to address some of the barriers that families face, because if they have a barrier to veterinary care, most likely there's a barrier to other needed services as well. And so taking a holistic view of that family, recognizing that we're there for the non-human, while somebody else needs to be there in this context for the human members. And again, if their ecosystem is low socioeconomic, so that's the three-legged stool of One Health: people, animals, environment, or ecosystem, that a viable system takes into consideration that low income means more than just limited money. It may mean limited education, lack of transportation. It's just thrilled with what you guys did in São Paulo with the public transportation piece as an example. That's what a One Health system will do. I'd love to see more of our communities do that here, and our work is intended to bring that model about.
Thank you so much again, Dr. Blackwell. And then I would like now that's another question, and also about your work that you're doing and now about this. And how can veterinarians support families that cannot afford veterinary care? Can you tell us about the program called AlignCare? Sure.
Well, AlignCare is something I very much welcome the opportunity to talk about, because it's really the first One Health healthcare system intended to operate nationally in the United States. It truly is a One Health system because it is a system, starting with that word. And what does that mean? Just structured. There are players who are identified as partners in that system and their roles and who's doing what, in other words, such that it all knits together in a way that we get better outcomes. So AlignCare was built on a One Health template. We, at this point, enrolled families who are already receiving public assistance. Why that population? Two reasons. That's where the problem is the most severe. So when we go to the lower middle class or the working poor, the Alice group, for example, they do have some options that you don't find with those who are on public assistance, like financing, for example, just to be able to get some credit to get the medical care. So we started there. We enroll these families. If they meet our qualifications, public assistance, they're expected to pay 20% co-payment at the time of services. We thought co-payments were important. Two reasons: it respects the family. People are not asking for a free ride. They don't want you to just take care of them. They just need assistance. They're going to do as much as they can. But the other reason too is the co-payment helps to regulate their expectations of what level of care they can actually receive, because they have to help pay for it. The veterinary practices are enrolled as providers because we've got certain policies like incremental veterinary care, which I can expand upon. And then there needs to be a fund account. So in essence, then, AlignCare is a subsidized healthcare system. The veterinary practice, if it's a for-profit practice, agrees to discount their fees by 20%. So the practice is able to do business planning because they know what their own fees are. They know how many families they can help in a year based on that 20% discount. The family then is expected to pay a 20% co-payment when those services, those discounted services, are provided. And then the AlignCare fund pays the veterinarian the balance. So it literally is a system with policies and procedures tested in 9 communities in the United States. And now we are implementing AlignCare in new communities in an expansion way, meaning working with the community to organize that system locally. I'm throwing a lot at you, and I would appreciate follow-on questions if I'm not touching up on something that you really need better clarification about. Subsidized healthcare structure, veterinarians want to help, they need assistance in helping. Families want to pay for their care, but they need assistance in paying for their care. There are people who care about animal welfare, who want to make funds available. There are people who care about family welfare. They want to make funds available. It just needed to be organized as a system. I think that's the key role, of getting the right people and then be organized. That's
I think, right? Because what I understood is the community that comes together and then they organize, and then who is going to get the grants, who is going to get the funds, and then they're going to get.
And it get competing there if you're not careful. Yeah, but go ahead.
No, yeah, and then I something that you don't have this in Brazil that is interesting. I think you have to start checking other models and also to provide care to for those that cannot afford. I think is a very important model that you can also explore and then talk to you. How can we implement this in Brazil?
Yeah.
Right.
I would encourage that One Health model. And I know that the public veterinary hospitals work with social workers, or social workers work with the organization. My understanding is maybe you've not matured that program to the level that we're talking about here, but maybe you have. But I encourage that, because if we don't focus on the humans, we will never reach many of these pets. The pets are dependent individuals. They're just like children here. They can't just go out and do this for themselves. And so understanding the family's reality and then working with them from that reality is what social workers do. And sometimes they facilitate communication with the veterinary practice and resolve some conflicts that might arise there. So they've been quite beneficial in this One Health system. Now, through time, we need to connect the two healthcare systems: human healthcare, veterinary healthcare. Why? Because of prevention and control of zoonotic diseases. We don't even exchange information. When veterinarians diagnose a zoonoses, like let's take Lyme disease, right? You would think that that's the kind of information that should make its way over to the family doctor, because it's quite possible that a member of that family could acquire Lyme disease as well, because it's already in the family. So same colony of ticks may have bitten the human. And yet that system can spend an inordinate amount of time and resources trying to chase down a problem that's Lyme disease. If they had just known that 2 months ago, the dog was diagnosed with Lyme disease, it might have gotten them more quickly to looking at that as possibility. So exchanging information is my long-term desired goal, so that it's kind of one healthcare system with respect to families. The shocking part for veterinarians is this. I'm like, so you do know that because we're talking about bonded families. Now, what's a bonded family? It's a family based on the human-animal bond. It's a love relationship. It's the pet is a family member. That's what the family reports. You do know then that you're in the business of providing family health care. The veterinarian is like, what do you mean that's family health care? Well, it's just like the pediatrician. Pediatrician focuses on the minors, but it's family health care. The gerontologist focuses upon the seniors. It's still family health care. We're focusing upon the non-human family member. It's family health care. If we can just change our mindset and recognize this is not just about animals, but family members, I think that alone starts to shape how we think about moving forward and building better systems and who we need to work with in our communities. It's family health care.
It's interesting how the concept, how the idea can change everything. And then I think it's little by little, and I can see that's a difference among generations, this definition. And then, yeah, it's interesting. And then when you talk about, I think when you talk about One Health, people only think about the zoonosis, of course, but there's other disease that affect the human members that's because
Yes.
affecting the pet, that's
Yes.
non-zoonotic. And yeah, that is That is, thank you so much. And then now I'm going, I think it's you already answered, but I'm just going to ask you on my, is it my one of my last questions. Do you believe that the veterinarians are one of the key players to promote social justice concerning the health of companion animals?
Absolutely. We need to add our voices to the dialogue and even the debate. Now, just to be clear to the audience, I am not saying that veterinarians need to start boycotting, protesting, carrying signs, walking up and down the street. You can choose to do things like that. What I'm really saying here is, and I'll use the United States data here because I'm more familiar with it than Brazil. So 70%, so more than 2 out of 3 households in the United States has pets. And more than 90% of those families consider the pet their family member. All right. So we already know in this country, we are this bonded family society. Okay. And just for reference, less than 40% of our households have children. So we really are family units made up of humans and non-humans. And when we think about healthcare, we ask ourselves the question, is that a right or a privilege? Well, I'm a strong believer that access to healthcare, whether you're human or non-human, is a right, you know, and in the United States, that's the policy that operates, meaning a person can walk into any emergency room in any hospital, in any community in the United States with an emergency need, and they must help that person. Now, in veterinary medicine, veterinarians will sometimes do some initial work to stabilize an individual presented, but too often people are just turned away when they have an emergency need. So we need to change our mindset about not only are we in the business of family health, but that it's actually a right, not a privilege to be able to access health care. A lot of what we keep talking about here is just mindset, because we are problem solvers. We can connect the dots. We can do deductive reasoning. This is how we become veterinarians and are able to work with patients that can't explain everything to us. So we ask ourselves, well, should that be limited to just inside my clinic? And I'm going to say this. We need the brightest people we have in our societies to be part of figuring out solutions. And clearly veterinarians are among the brighter people in any society. It takes a pretty good intellectual capability to become a veterinarian. So it starts with an attitude, yes, everybody has a right to healthcare. When they don't have access to healthcare, we have a responsibility to add our voice to solutions. Sometimes that may be in the context of facilitating or encouraging legislation that's going to get to a better place. Sometimes it's just simply working on your own, in your own sphere to develop that One Health approach. If you don't have an AlignCare in your community already, build it, or invite a system in like AlignCare that will help bring that about. That's being responsible on the social justice front. And we do have that responsibility.
It's great. Now, my last question. And what recommendations would you give to students and professionals in the veterinary medicine who want to promote equity?
Yeah, I think my number one recommendation is understanding that a lot of the systems in many industries that we see operating today were built in the 20th century. And I'm going to assume people were making the best decisions they could and how you build these systems, but it was a 20th century. The 21st century brings up a number of things that have changed. For example, being a bonded family society. And so we need to question whether the way we're going about providing the services is the best way to do it. I know in the United States, the short answer is no, because you don't get more than 1 out of 4 families not having health care, and yet at the same time, say you've got a good healthcare system. That's too many people who don't have access to healthcare. And so when I drill down in the United States, what I see are these practice models built in the 20th century during the time we had a thriving and growing middle class, and the middle class had discretionary money to pay veterinarians, cash for services, no insurance, not really good financing. Our middle class is shrinking. The discretionary money is gone. And so the system built in the 20th century does not work for an increasing number of families. So millennials are the people I look to solve a lot of the problems, because as a generation in this country, it's the largest cohort of Americans, largest group that lives with non-humans, the largest voting bloc if they chose to organize themselves, and increasingly the ones in decision-making positions or will be holding public offices. So when I look at that generation, we need to be working with that generation. When they say, I don't want to do it this way, I don't think that's smart, we need to pause and listen for a moment, because life does not improve except every generation brings something new to the table. And if we shut down the next generation, the millennials in this case, and Gen Zs, then we're going to do harm to society. So we need all voices. That's another form of diversity, by the way, diversity in the voices. And this is one of the strongest reasons why diversity is so important. I just will close on this point. I've heard too many people beyond veterinary medicine who have very, very negative opinions of millennials, and they have their reasons, okay? But I say to them, we can't skip a whole generation. It doesn't work that way. So let's hear what they've got to say as a generation. Push back on ideas that don't make sense, and let's keep this old head and this young head together and come up with a much better outcome. I think it's exciting to interact with millennials for that reason.
Yeah, thank you. Yeah, I interact a lot with millennials. I think Bruna is millennial. I think it's so important. I think every generation has its own, have someone's strength, and then I think the point is the beauty, right? Yeah. And it's interesting because you use these terms a lot in the United States. However, in Brazil, don't use so much, and then I can see the difference. And it's very abrupt, and we seen here, and it's incredible. Thank you so much, Dr. Blackwell. It was wonderful to hear you.
I appreciate the opportunity to visit with you today, and thank you for considering me someone you'd want to talk to for your audience. And I certainly wish all of you in Brazil the very best, and that the veterinary profession will keep being proactive and bringing about the changes that we already see underway in São Paulo.
Thank you so much.
Thank you, Bruna.
Thank you.
Dr. Tancioni.